Arthritis is typical because it has to do with changes in the bone structure of a joint. So you can have arthritis in any joint in your body, but it's pretty common when you have two joints that come together, usually big joints, and the cartilage material, like the labrum, thins away. So you're not having such an easy time moving your shoulder anymore because it's starting to thin out and thin out. So when that thins out, this guy doesn't have something easy to glide on. And when that doesn't glide very well, that's when you start feeling those snap, crackle, pops in your shoulder. You start having pain when you try to move your shoulder. And it's all because of this breakdown of the cartilage. Here is our shoulder, our clavicle, and the acromion. So where these two guys meet over here is the AC joint. And in the AC joint, it's a very small space, but it's another joint which is pretty popular where there's arthritis. And usually at the AC joint, we're talking about some extra bone formation going on here. When extra bone comes in and forms underneath this joint space, it kind of rubs and rubs and rubs. And so it's impeding on the ability for any kinds of ligaments, tendons to get through, and it just rubs away at them and it causes pain. So what kind of symptoms? So obviously pain, but where is your pain? So a lot of times when you have arthritis in the shoulder itself, a lot of the pain will actually be referred in the back of the shoulder if it has to do with the actual joint. You can also have pain along the top of the shoulder, and that's because of that AC joint issue. Generally, most people will be really, really stiff, and that's pretty common, especially first thing in the morning when you haven't moved around all night. As you move throughout the day, you may notice that the stiffness gets better and you're having a little less pain. But obviously when you do too much and you're overusing your muscles and you're overusing your joint, then you also get pain because you've overdone the activity. People will complain that they can't lay on that side. That's because when you lay on that side, so here, this would be like the right shoulder. If you're laying on your right side when you're sleeping at night, you're compressing that joint. So you're kind of smushing this guy into that socket where you don't have a good lining going on in there. And because of that, anytime you put pressure on that, it's just compressing bone to bone. Because there's less cushioning, there's no shock absorption, and then there's more pain, and then you'll notice that you can't lay on that side anymore. So the other thing is the crepitus, when you hear all kinds of funky noises when you're trying to move your arm. Our joints make noises, sometimes it's air, but if the noise is associated with pain, that's when there's an issue. With arthritis, you're going to lose a lot of range of motion in several different areas. So reaching up this way, trying to reach for the seatbelt to put upon you this way, arm behind the back, you're going to notice that you start to have limitations in all those range of motions. So how does PT help exactly? Well, we always like to educate our patients really well. And obviously if this is a bone issue, which arthritis is, we cannot change the structure of your actual bone. But the thing is that you want to actually work on strengthening everything around the joint where the bone and the bone are together. So if you strengthen everything around the joint, you're giving it a good stability area so that all these muscles will be strong, and it's going to take the brunt of the force away from the actual joint, which is just the bone and the other bone. The other thing that PT does is that we can actually move your arm and work on things that you can't do on your own. So what we do is a lot of joint mobility, where we actually get our hands on the joint and we actually move them in ways to improve the mobility of that arm bone on that shoulder so that you can increase the range of motion. The other thing is some soft tissue restrictions. Like I said, if you have some pain from having a tight pec muscle, sometimes people get some tightness in the back here, we can dig in there and get that out for you so that you can tolerate the exercises better and then get to the point where you're not having soft tissue restrictions, and then you just need to work on exercises to actually stabilize that joint.